Hello, my name is Cassandra Blanco. I am Roman Catholic and I welcome you. Today's guest is my friend, Dr. Mario Sacasa. So we're just going to go ahead and jump right in and I'm going to go ahead and let him introduce himself. And maybe Dr. Mario Sacasa, you can go ahead and share just a little bit about yourself, where you're from, where you were raised, and then also how you became a counselor.
Sounds great, Cassandra. Well, it all started when I was a little toddler back in the shores of Florida. I'm just joking. We gotta. No, I'm just messing.
In your mother's
In my
womb.
mother's womb, I felt the call from Jesus, like John the Baptist. I leapt in the womb when Jesus said, "This man will be a therapist." That's exactly what it was.
That's awesome.
That's my story, and I'm sticking to it. No, I just grateful to be here with you and your guests, and excuse me, your audience, to be able to talk about addiction and all of that. But I guess just to answer your question, my name is Dr. Sacasa. I've been a licensed therapist for about 20 years now. I'm married also for 22 years. Have four boys that are just becoming men, which is incredible. And for me, I've always just try to find the points of integration between what our faith teaches us as far as truths and understanding of the person, and the understanding of the person's relationship to God and that journey towards heaven. But coupling that also with what science teaches us as best practices and what leads us to better mental health, what leads us to better emotional health, what leads us to better relationship health. And I think that there is a way to find that integration. There is a way to be able to navigate appropriately what the church teaches and what psychology and counseling literature teach us as well in terms of best practices, as I've indicated, and what helps us to be able to grow in healthy ways. So finding those points of integration is kind of the summation of my career. Everything that I do, from the clinical setting to my work on my podcast to my speaking engagements, is all centered at helping people to be able to find a better life anchored in both their faith and in science. And so that's my mission. That's what I'm here to do, and let's keep going.
Awesome. Amazing. And you have a doctorate as well.
Hmm.
Can you just maybe share just briefly what is the difference between a psychologist, a therapist, a
Sure.
counselor, a psychiatrist, just so that we can clarify what that means and then where you stand in that?
Yeah, that's great. Okay, so there's kind of tiers when you think about the license. A license is just like we think about a driver's license, or if you want to go fishing, you go get a fishing license, right? It's a permission to be able to do the activity that you are trying to do. You can't drive without a driver's license. You can go fishing without the fishing license for the day. You can't practice counseling without a clinical license. Now, in the mental health field, there are really kind of three specific domains when it comes to, like, activities. I would say three specific activities that we would say different licenses have the ability to do. You do counseling, you do assessments, and you provide medicine. Those are the three kind of buckets. So if we start at which license allows you to be able to do all three of those, well, we would say psychiatry would be the route there. So psychiatrist is a medical doctor who did 4 years of medical school, and then they did their 3+ years of residency in psychiatry. And their training in psychiatry allows them to be able to do all three of those. So they are trained to be able to provide medicine. They'll be able to provide psychotherapy should they want, and to be able to provide some assessments should they do that. Now, most psychiatrists just really focus on the med management side of things because there are plenty of other people who can provide the others. So they're unique in that they mostly just provide medicine and med management. So then we go down the next step. The next step would be psychology. And so psychologists also aren't medical doctors, but do have doctorates. You have to have a doctorate to be able to get a psychological license. And that could be both a PhD in clinical psych or a PsyD as well. Either of those will allow somebody to be able to practice as a psychologist. Well, what's a psychologist? Psychologist allows you to be able to do two of those three, which is the counseling, psychotherapy. We can use those terms interchangeably, but then also to be able to provide assessments. And so you would go to a psychologist if you're a seminarian, for example, who needs an evaluation to go into the seminary, or for work, sometimes you need to have evaluations, or if you're a parent who has a child who needs some type of psychoeducational testing, psychologists are the ones who specialize in that, while also being able to provide psychotherapy or counseling as well. And so those are two of the three. Then we get down to the lower rung, And the lower rung would then be the clinical licenses that allow folks to be able to just to provide counseling or psychotherapy. And there's three. There is counseling, there's marriage and family therapy, and there's social work. And so some of those have different names or acronyms in different states, but mostly it's that clinical mental health, licensed marriage and family therapist, and then licensed clinical social worker. Those three are master's levels where you only need a master to be able to acquire the license to do the work. And your focus is on the clinical counseling setting. Can't provide medicine, can't do assessments, can do some assessments when it comes to mental health, but not in terms of any sort of psychological psychometrics in that regard. But those are the folks who provide counseling. My degree is in counseling. My master's is in counseling. I'd been practicing for a number of years, and I went back and got my doctorate in counseling education and supervision. That allowed me to be able to explore faculty positions in counseling programs. It allowed me to be able to write a dissertation, which was a transformative process, and it fulfilled a lifelong dream of being called Dr. Mario. So ever since I was a kid, when I got the game, on the Game Boy, playing the little game, I was like, someday, I will be Dr. Mario.
And just as an aside, Dr. Mario actually and I know each other for many years.
Many years.
Yeah, since I was, I think, a freshman in college.
Yeah, you were a freshman in college. When did we first meet? When you were coming
I went up to Holy Trinity, Alabama,
yes.
And Dr. Mario and his wife were serving as missionaries, and I met them, and I found them. Actually, you were so inspiring to me, because I just had such a love and a passion for evangelization and share my faith and ministry. So I just found that experience. So we've known each other many years.
Yeah, it was
so
just
good.
A few years ago.
Yes.
So
yeah, so glad to have you. So now that you've explained that, can you maybe just go into an explanation of what you view as the role of therapy in a person's life or counseling in a person's life?
Yeah, that's a great question. I would say that the role of therapy or counseling is to help somebody overcome whatever acute or particular emotional challenge that they're experiencing, right? So there's some behavior that they're stuck in that they can't seem to get out. There's some thinking that they're stuck in that they can't get out of. There's some relationship difficulties that they're stuck in and they can't get out of. Therapy is a place for you to be able to process what you're experiencing while also gaining the tools that you need to be able to grow. If we look at kind of, again, levels of intervention, we live in a day and age now where there's so much information that's out there. Here we are, we're doing a podcast interview. And so people can listen to podcasts on topics related to anxiety or depression. Wonderful. Get the information that you can acquire, learn as much as you can from self-study, self-help programs, do it. But if you can't assimilate that, or you can't translate what's being said in a podcast or in a book into your own life and apply it appropriately, you're finding that you're not able to take that next step, well, then that's where counseling can help. We also have, of course, community and friends, which are well-intentioned. They're great, and lean on your friends. Absolutely. Do the exercising, all the stuff that you can do to support your mental health. But once you feel like you've exhausted all your resources, you've gone to your friends, and it's only done so much. You've done the exercise, it's only done so much. You've changed your diet, it's only done so much. You've listened to the podcast, it's only done so much. It's like once you feel like you've exhausted your natural resources, that's when you should start considering counseling as an option. To meet with a therapist, to work through, again, what's going on, to meet with somebody who has expertise in this that can help see and identify the problem through their particular theoretical lens, and to be able to provide strategies and tools to help you to overcome the challenges that you're experiencing. So counseling is a really, I would say, a valuable resource to help people navigate the complexities of life, meet with somebody that you trust, develop a really good relationship with them, and you'll see that it can be a really beneficial experience for you.
Mm-hmm. Beautiful. And so we're going to hone in specifically on this podcast on addictions. So why don't we just go ahead and introduce that topic? What would your view be of what an addiction is, how it manifests itself, maybe even what are the root causes of an addiction? I'm going to go ahead and ask those questions first.
Yeah, so the first question would be, well, what is an addiction? because that term is thrown around so often. It's like, I'm addicted to my iPhone. I'm addicted
Mm-hmm.
to social media. I'm addicted to Snickers bars, Now, those are all process addictions. Those could happen, all right? But we tend to throw them around kind of casually in our culture. So I would say the classic definition of an addiction is the inability to stop particular behavior or action despite negative consequences. All right. So it's bad, it's wrong, but you still can't stop yourself from engaging in whatever that particular activity is. So think of something like drinking, for example. There's people who have real mastery when it comes to drinking. They know their limits, just 1-2 drinks on a weekend, when they're out socially, no big deal. They have real firm kind of boundaries on that. No problem. But then you can start going down the kind of level of my free will, my freedom being compromised. The next step would be something like where it starts becoming problematic. Maybe I when I'm really stressed out, I find myself that I'm drinking, 3 glasses of wine a night. We still wouldn't say that's at an addiction level, but we're trending in that direction. It's starting to become a problem, or there's a negative pairing between stress and drinking, and now I need drinking to be able to overcome this stress. Okay. And we can substitute anything for drinking. Okay. But I'm just using that as an example.
Mm-hmm.
And then the next rung would be a sense of it being an addiction is my body has become habituated to needing this substance to be able to function normally. And so like I drink a case of beer and, every night, or something excessive that we've come to. All right. So that now, and then all the negative consequences that come with that. People who smoke, everybody who smokes knows that it's an addiction, and and everybody who smokes knows that it's a nasty habit. Right.
Mm-hmm.
And so, but they still do it. Why? Because the smoking or the drinking, the body has become conditioned to needing that substance in the body. And that is what is when we would say it's an addiction. Okay. So inability to stop negative consequences despite, this inability to stop said behavior despite negative consequences. And then the other thing that you want to look for is the presence of withdrawal symptoms when you're stopping the behavior or stopping the substance, as well as tolerance, an increase of tolerance, right? So it's like the body plateaus and gets used to, right? So you do the 1 drink, then it becomes 2 drinks, and it becomes 3 drinks. You need to keep increasing to get the level of the high that you were getting before. That's tolerance. So those all of those factors are what we're looking for as therapists when we're saying somebody has an addiction. And I think that's important for our listeners to be able to understand that,
Mm-hmm.
because sure, okay, I can say that I have a susceptibility to social media and I can doom scroll. Okay. I know when I fall into a trap where I've spent 2 hours on Twitter or YouTube and be like, what did I just do? I can't get that time back in my life. If I set a block and I decide that I'm just not going to engage with this anymore, this is
Mm-hmm.
what I did for Lent, by the way. Okay. So, just gave it up for Lent altogether. There wasn't an experience of withdrawal symptoms. I mean, there were moments where I was like bored or maybe was gravitating towards it, but it's not the same thing as stopping drinking or stopping smoking, where there's real bodily sensations that emerges. Or even pornography, for example. Pornography can have
Mm-hmm.
withdrawal symptoms as well associated with it. So just want to help people kind of navigate that, where we could say, okay, we can have certain mastery over these behaviors, but then it starts becoming problematic at some level, whatever that looks like for you. It can
Mm-hmm.
be different. But then there are real addictions. And I reiterate that those addictions are an ability to stop despite bad things happening, presence of tolerance, presence of withdrawal. Those are the qualities that we're looking for when we're trying to define an addiction.
Mm-hmm. And when you are talking about symptoms of withdrawal, are you talking about physiological, like, I don't even know if that's even the right word I'm
Absolutely.
using,
Yeah,
but okay,
yep,
like
yes. Yep.
sweating, like,
Cold sweats, that
you know,
happens with drinking. Yep.
okay.
Yeah, drinking. If somebody is I'm saying a long-term alcoholic and it's high
Mm-hmm.
levels of alcohol, it's not encouraged to stop cold turkey, because you can actually create a situation where you can get seizures. I mean,
Mm-hmm.
so because the body has become so conditioned to that chemical being present, that it absolutely can create that. So certainly there's physiological withdrawals in that sense,
Mm-hmm.
but there's also emotional withdrawals, this sense
Mm-hmm.
that this thing has been there with you for a long time, whether it's drinking, whether it's dip, whether it's smoking, whether it's a porn. You almost develop a relationship. It's like a like a bad ex, like she's like,
Mm-hmm.
she ain't good for you, but you still keep giving her a call, like, you know, but she's been there for you, with you
Mm-hmm.
throughout the bad times, because that's
Mm-hmm.
often when you turn to it. So there
Mm-hmm.
is this emotional attachment that has been formed to the substance or to the behavior that, as weird as it may sound, there's a little bit of a grieving process that needs to happen as well. And
Mm-hmm.
so letting go of the behavior, letting go of everything that's associated with it. You smoke when you're at a party, and so it feels comfortable. You're drinking when you're hanging out with your friends, and so now you feel ostracized. There's a lot of social factors that play into the process of recovery as well,
Mm-hmm.
that can make it difficult for folks.
Mm-hmm. Okay, so switching
Yeah.
gears, maybe we can just back up to a person developing an addiction.
Mm.
From your view, experience, both counseling and then also just knowledge from study, how do you believe a person forms an addiction?
Yeah. Well, I think it's a few different factors that we can look at, and maybe one doesn't fit everybody. There are certainly some people that are just born with a proclivity towards it. Talk about like an addictive personality. That may not be the exact right phrasing, but there is a sense that some people just are a little bit more predisposed to be susceptible to an addiction. We know that there are genetic factors. If alcoholism runs in the family, be cautious about that. Be aware of that. If you know that it's somewhere along the family tree that's been present in your life, be attentive to that. So certainly there are some genetic factors that play into that. But then environmental factors absolutely play a role too. Whether it could be trauma, that some traumatic experience happened, and the only way that you were able to cope was through the addiction behavior, because it provided mood altering substance. It provided a high that you needed for sure to be able to get through whatever the difficulty was that you were going through. So there can be a pairing that's there. But then what can also happen is just kind of a casual backing into an addiction, so to speak, where you go to college and you start partying and you have it under control at first. This is the tolerance thing that I was talking about earlier. You're introduced to a substance, introduced to a drug, introduced to alcohol. It's like, all right, no big deal. We just do it on the weekends. All of a sudden it's gone from 2 to 3. Then now I need to feel like I have to get smashed every weekend. And then at some point it becomes more than that, and it continues to increase. And all of a sudden you've kind of backslid into having an addiction, and you realize like this thing's starting to impact my relationships. It's impacting my ability to work. It's impacting my ability to focus. It's impacting my ability to get my studies done, because and I'm spending a lot of time being preoccupied about it. So there can be a sort of gradual back-ending into it as well, that we just need to be aware and attentive to. So in terms of like clinical treatment, I know we're going to get into that in a second. It will change based on how people first developed this addiction.
Mm-hmm. So let's get into that. What do you see are the treatments for somebody if somebody is struggling with an addiction? How would you advise, just a general, where would they start to try to get on that road towards freedom?
Yeah, I'm a big supporter of the 12-step programs. They've worked. They've been around for, I don't know, it's 70 years now at this point, and they've been around for a reason. They work. So back to like the levels of intervention, like depending on where you're at, I think a great first step is get plugged in to a 12-step group in your area. If it is alcohol, there are AA groups all over the country. If it's something related to hard drugs, narcotics, there are NA groups all over. If it is sex, love, addiction, there are SA groups that are available. I mean, there is no shortage of support groups available to you. And so start there. And even if you go to one group and you feel completely out of place, just stick with it. Give the group a few times. If you recognize that maybe after a few meetings, that you're not really connecting with the people that are there, move to another group. Find a home group that is going to feel comfortable for you. That's going to feel like a place where you can actually open up and you can share. So I think 12 steps is a wonderful model. We could talk about why. I think it's effective also. But as far as me being a therapist, and when somebody comes in and presents this need and wants to work on it, what I say to them is that we're going to take kind of a two-pronged approach, which is on one side, we're going to do the depth work. We're going to reflect on where it emerged, what might be the social conditions that help you understand an awareness as to where this is continuing to be problematic and why it's there. But then we also need to create some type of safeguards and behaviors as well. We need to put some safeguards in place. So for example, talking about something, maybe porn addiction. I know we're speaking globally about all of them, but for porn, I will talk about when did you first discover it? What was that like for you? What was going on in your life? And it could just be that they were 13, a high schooler, and then slowly, like I said, backed into it, as they got older. There isn't a real presence of trauma that's there. Maybe in some cases there's a presence of trauma and that they were abused, or their mom was manipulative, or their dad was harsh and critical, and they turned to it as a means to be able to find some type of self-gratification. Okay, we can work with it. We can understand it. We can see what are the patterns that you've created around that negative experience in your life. But then we also need to set up the safeguards as well. So we need to talk about, should you sell a smartphone? Do we need to have filters on things? Who's accountability partners? What psychoeducation are you doing to be able to understand how this operates within your brain? Both of those are what we do in counseling. And counseling allows us to be able to go into the depth stuff as well as be able to provide, like I said, skills, get more tools in the belt. What I said earlier, that's what counseling does. And we can do that in a highly specialized fashion when it's just one-on-one. We're together for an hour. I'm only listening to your story, and I'm trying to help you better understand it and help you to grow from it. That's what we do in therapy, is to be able to help people grow in understanding their story, but then also grow in the here and now and say, okay, what do I need to do to be able to overcome this addiction?
So can you, I know you touched on it with the 12 steps. What would you say are the pieces that make up why 12-step programs are successful? Like if you've seen success for people who have overcome addictions, what are the, pieces to that?
Yeah.
The fabric.
Yeah, absolutely. Well, the first 3 steps are all about surrender. Okay. It's all about surrendering to a higher power, surrendering to the Lord, recognizing that this thing has a power over me and I am helpless against it. Now, some folks can look at that and say, well, that's an awfully negative way of starting. But rather what it is it's a place of starting with profound humility and just acceptance, right? This is where I'm at. My life has become unmanageable because of this thing. And I acknowledge that it is very easy for me to succumb to it. So this thing has a power over me. My life is unmanageable. And I need the presence of something larger than myself to help pull me out of this. And so that's the very beginning of the 12-step model, is to begin in a place where you say, all right, I need just to have radical honesty. And that radical honesty, that radical transparency is part and parcel within a 12-step group. They call each other out. They live by just radical transparency. Why? Because they know that that we can convince ourselves that anything is a good decision. When you're in the throes of an addiction, or you're in the moment when you're feeling bad and that bottle is right there, our brain creates this narrative that we can say, oh, it's not as bad, or I can justify it at this moment. Nobody will find out. All of that stuff that we start telling ourselves in those moments. The only way to work against that is by having this radical transparency, by having this radical honesty. And you'll see that in 12-step groups, and you'll see people who have overcome their addictions live by this type of radical transparency, radical openness. That sometimes it's like, oh, okay, hold on, I wasn't asking all that, but they do, because they recognize that I just have to be this open with this group of people. So it's that, right? It's the acknowledgement that my life has become unmanageable, having a sense of humility about that, living by a sense of openness and transparency, surrendering yourself to a group of people, having sponsors, folks who have walked the walk, who have walk through the fire and on the other side of it, that they can guide you and help you through that. So having a sense of mentorship, and then doing the work of growing and understanding yourself and making amends with the people in your life, so that you're starting to heal yourself, but putting yourself back in a context where you can then open up and start healing the community that you've offended and that you've hurt because of your addictive behaviors. So the 12-step model works because of each of those elements. And it's the gestalt of it, so to speak, right? The whole is larger than the parts, but it's the totality of that allows people to be able to overcome their addiction.
Yeah, because I would say that one of the parts of an addiction is that intense hiding and the lying. Like, I didn't drink, or hiding the bottles, or, I know a lot of people in 12 steps or in AA talk about how they had bad finances and they were stealing. And so it's like this whole process of first becoming clean to oneself and honest with oneself about what's happened, and then also moving forward, also doing that with others, which I know is also part of that Amends program.
Yeah, absolutely. You got it. That's it. And so remember what I said earlier, inability to stop despite negative consequences. I mean, that's what we're speaking about. Like, you're stealing money. Why? Because you need the addiction. Something inside the brain has equated that substance to survival. And it's I need this to be able to live, is basically how the brain feels. And so that pairing needs to be broken. That needs to be broken. And it's gradual work that allows you to be able to break that. So like you said, exactly, the lying, all of that stuff is part of it, which is why these groups they confront that, pretty head on.
Have you found anybody that was not successful in 12 steps that needed something deeper than that? And do you have any thoughts on that? Like, for example, rehab programs or anything like that?
Yeah, no, definitively. Yeah. So again, back to levels of intervention. If the 12 steps alone isn't working for you, or counseling alone isn't sufficient, then certainly that's where a rehab program would be something to consider. And even in rehab programs, there's intensive outpatient programs. So there are hospitals or treatment facilities in your area that may just do like an 8 to 5, so you don't actually have to go away. You go from the morning to the afternoon. It's what's referred to as an intensive outpatient facility. And then there are inpatient facilities where you actually go away and you spend a few weeks or a few days in a facility where they're going to manage your time and keep you clean. So certainly that is a viable option for people who are really deeply in the throes of addiction.
Right. And I would ask another question about this, just about a treatment program or somebody trying to overcome them, is just if you have thoughts on the importance of discipline, because part of an addiction is the lack of discipline and something that has become out of control. So do you have anything just about the role of discipline or steps that a person can take, like maybe the importance of exercise or anything else that you think in that area is beneficial?
Yeah, I mean, that goes back to the serenity prayer, right? Which is, Lord, help me to accept the things I can't, the courage to change the things that I can, and the wisdom to know the difference. That if there's certain acceptance that needs to happen about events that have happened in your life and you can't change them, okay. But where are the things that you can change? If you know that you're at the beginning of recovery and you're not going to be able to stop every single time, okay, but what do you have control over? Where is a sense of agency? Where do you feel that you can take a step in the positive direction? And that could be exercise, that could be eating healthy, that could be watching your tongue, that could be going to sleep on time, that could be fostering prayer. Absolutely. Finding one thing that you can take that next step on to acquire more discipline within your life absolutely will translate over. And so it is both of those where you have to have some acceptance about things, but then you also need to be able to grow in discipline on the areas that you can. Now, you're not going to be able to just will it or white knuckle it. You can't just, most people can't just stop cold turkey. They need a process to be able to gradually decrease the behavior. So, when I say discipline, I'm not saying just will yourself and grind it and white knuckle it. That's not going to happen. Avail yourself to the community that can help you with this. Avail yourself to the resources that are going to help you with it. but then grow in the areas that you can, you said.
Right. Absolutely. Yeah. Community, transparency, discipline, therapy, if
Yep.
that really could help, that self-awareness, like what is it that's driving me to that substance, becoming self-aware
Yep.
so that next time that happens,
Yep.
that, okay, I know this is what's driving me, and maybe finding new ways to be able to deal with those feelings,
Yep.
emotions,
Yep.
memories,
All of
all
it.
of
You
that.
got it. Yeah. Or even just time of day. I know that if I'm alone on a 2 o'clock on a Saturday afternoon, and I'm just probably going to feel lonely, and that's probably the time I'm going to want to, look at porn, or in the evenings after work is when I'm more likely to want to smoke a cigarette, or, dip or drink or something. Right. I mean, yes, know thyself, and then just operate accordingly, at least begin to operate accordingly, and knowing
Mm-hmm.
what those limitations are.
Mm-hmm. All right. So we did cover just overcoming an addiction. Another question I had was just about the role of counseling. You've kind of dipped into
Mhm.
that. Is there anything else you want to talk about that, just the role of counseling or
Yeah. I
therapy?
mean, counseling's great. Counseling, you just have to find the right therapist. Again, um, it's like when you find a barber or hairdresser, when
Mm-hmm.
somebody just knows how you like to get your hair cut,
Mm-hmm.
you're going to keep going back to that person. It's the same thing, that when you find somebody who understands you, who knows you, and you've developed a relationship with somebody that you can trust, that's what you want to keep going with. So
Mm-hmm.
I know it's discouraging for some people where they're trying to find a therapist and they can't seem to find the right person, or they finally worked up the courage to go,
Mm-hmm.
and then there isn't a match personality wise. Like it's okay. Like just be patient with the
Mm-hmm.
process until you're able to find somebody who really gets you, and
Mm-hmm.
trusting in providence that God will guide you, to that person.
Yep. One other question just about this topic as
Mhm.
well would be, do you have any thoughts on the people that are around the person who has an addiction? Spouse, parents,
Mm.
children, how they cope, what they should do? Any thoughts on that?
Yeah, so there are groups. Al-Anon group, for example, will help people navigate that, specifically, because the challenge is setting boundaries and healthy boundaries. How you can't enable, are you enabling the addiction? I mean, those are hard questions to ask. Are you codependent on this person? Did you need this person, secretly actually need this person to be sick so that you could feel better about yourself and your life?
Mm-hmm.
I mean, there's a lot of questions that can be activated within that. Are you bitter? Does there need to be forgiveness work? I mean, there's a lot that needs to happen there for sure. So anybody who's struggling with a family member, I would say join an Al-Anon group, or again, go to counseling to be able to work through those feelings.
Mm-hmm. Awesome. And then lastly, do you want to share thoughts on what you believe is the role of the spiritual world, prayer, all
Hmm.
of that, just in a person overcoming addiction?
Yeah, again, just going back to like the 12 steps, if we use that as our model, that first step is acknowledging that there is grace. And they would say higher power for sure. There are groups like Catholic in Recovery that will use more specific Christian language on that, or Celebrate Recovery is another program that's popular within non-Catholic Christian circles. That find a group, okay? But the point is, like, we're all sinners, and we all need to cry out
Mm-hmm.
to the Lord to help us. And I think the addict knows that and understands that more acutely than maybe most of us who feel like we have it all together. There's a certain poverty that exists in the addict's heart, and that poverty allows them to recognize that I can't just save myself.
Mm-hmm.
Um, and so I need Jesus. I need the Lord. I need the Holy Spirit. I need something larger than me. I need this grace. I need this presence. I need this reality. I need Him to save me,
Mm-hmm.
to redeem me, to bring me back into wholeness. So I think that that's one of the reasons why I do like the 12-step program, is that even though it loses some of the particular language by referring to a higher power rather than what I would feel more comfortable speaking about God, in the Christian sense of the term,
Mm-hmm.
but at least there's an acknowledgement that there's something little about us and we're struggling and we need something bigger that's going to help us. So
Mm-hmm.
absolutely, the Lord is with us all along the way. The other piece that I would say in terms of the role that faith plays in this is just, I reiterate the notion of trusting in providence. It's not that God willed you to struggle with an addiction or that God desired for you to struggle with addiction. But your growth in overcoming this addiction will be part of your story and will be part of your growth towards holiness. And God will use whatever cross manifests in our life to be able to lead us towards that Easter joy. And so do the work, bring the Lord along for the ride, and you will see that you will grow as a person, and you will grow in intimacy and understanding him as well as he reveals himself to you in every step along your recovery process.
Beautiful. Is there anything else that you want to share, Dr. Mario, about addictions and any other resources that you think are helpful for people who are struggling with addictions, just having a hard time? Any good resources that you know personally?
Yes, I encourage people, if folks who are listening are Catholic, look up Scott Weeman's work with Catholic in Recovery. Him and Father Sean Kilcawley have a podcast together now. I think it's called like the Catholic in Recovery Podcast. So certainly I want to encourage that. If listeners are not Catholic or are Catholic but aren't, I don't know, tried the Catholic CIR groups but didn't work for them, then I would say check out Celebrate Recovery as well as another great resource. And those are usually in evangelical churches in your area. That was started by Purpose Driven Life. His name's evading me right now. Rick Warren, his church, Saddleback Church out in California. So that's another great resource as well. Check those programs out. And then again, like we live in a marvelous age where we can look up any resource that we want. So avail yourself to podcasts, avail yourself to resources, read the books, understand what you need to do to be able to grow on this. Like, please just take one step forward and keep going. Keep going.
And then do you know of a website if a person is looking for a local Catholic therapist? Do you know of any websites that they could look to find one in their area?
So you can certainly go onto the Catholic Psychotherapy Association website and look up the member directory and try to find somebody locally, or at least within your state. Earlier conversation, we were talking about licenses. It's the state, the jurisdiction of the state that gives the license to be able to practice. So you want to find somebody in your state. And right now, every therapist has become comfortable doing remote work. So even if they're not in your city specifically, but they're licensed in your state, then reach out to them and see if they can provide telehealth services to you. So Catholic Psychotherapy Association is where I would start. You can also go on the website catholictherapist.com, and that also is a resource for folks to be able to find a counselor in their area. If those don't work for you, then you can certainly reach out to your pastor and see if he has somebody who he recommends. And if he doesn't have anybody, then I would reach out to your diocesan family life office, because almost every diocesan family life office is working with counselors in their marriage prep programs, in marriage enrichment programs, and whatever other programs that they offer. They would have a list of people in the area as well. So hopefully between one of those four options, you'll be able to find somebody. And then, of course, just a fifth option is just asking friends and being open to acknowledging that you need a little bit of help. Now, if all of those don't work for you, then another great resource is just going on to Psychology Today, and you can do a search of therapists in your area, and then you can check off certain qualifications that you want. And one of the boxes, if you're looking for somebody who's Christian specifically, you can check that off. And so you'll find a religious-minded, a Christian-minded counselor in your area as well. So Psychology Today is another platform for people to check out.
Oh, awesome. And then lastly, your own work. You have your own YouTube channel and podcast. So would you like to just share where people can find you and your work as well?
Yeah, absolutely. So if people have been enjoying this conversation, and please head on over to my website, drmariosacasa.com, where you can avail yourself to all the resources that I have. My podcast is called Always Hope. I've been doing the show for about 7 years now. I started in 2018, so I kind of been doing the podcast thing for a little bit now. I'm on YouTube as well, Always Hope at Dr. Mario Sacasa. Either of those will get you there. And the whole premise of the show is, as I've mentioned, I want to help people live a better life. And I want that to be anchored in both their faith and together also with what the science teaches. And so that kind of integrated approach that maybe somebody got a flavor of by our conversation today is, again, bleeds throughout the whole podcast. So please check out the show, Always Hope. You can find it on YouTube. You can find it on any podcast app. If you just like the audio only version of it, check it out. I think you're gonna deeply enjoy it, and I think it's gonna help you grow in your life.
Awesome. All right. Well, thank you so much, Dr. Mario Sacasa, for being my guest. And to my audience, if you do have any questions or comments, please leave them in the comment section. I hope you have a wonderful morning, day, or night wherever you are in the world, and God bless you. Bye-bye.